Hey, everybody, and welcome back to another episode of the Bulletproof Dental Practice podcast. Peter and I are very excited today to have Dr. Jenny Perna with us, the yogi dentist, right?
Yes, Yogi Dentist, Instagram.
That's awesome. So kind of a funny story how we got connected. I was, on Instagram, I saw that you discovered our podcast, but funny enough, you had actually had a filling done in our office, right?
Yeah, I
Yeah.
did. So I did dental school down in Nova and started to go, you know what? When was the last time I got x-rays? Went to my clinic, took a couple x-rays, realized I had cavities. And like when you know too much, and I was like,
Yeah.
who am I gonna get to fill these cavities? Am I gonna
You're
let
like,
dental
nobody here,
student?
no one here, so peace
I
out.
So one of my good friends actually recommended your office, and so I went over there and got a couple cavities filled. They look great. The fillings look great till this day.
Cool.
That was probably like
Wait, did
7
Craig
years
work on
ago.
you?
No,
No,
one of the
Dr. Dudley
associates.
did. Yeah,
Yeah,
Dr.
Oh,
Dudley
wow.
did.
yeah,
Wow.
but that was my first introduction to how nice your operation is over there.
Cool. What year was that? Do you remember?
Oh geez, it was probably
I could pull your chart
2012.
actually.
Yeah, right.
So it wasn't in the new building, it was in the old building, right?
Yes, I don't
Okay.
think I've seen the new building,
Okay, cool. Well,
but
next
I've
time you
heard
come
good
down
things
here.
about it.
That's awesome.
It's
Yeah.
all
It's such
right.
a small
It's all
world.
right.
It's
It's
just
all
okay.
right.
It's just
Yeah.
okay. Yeah, it is a small world. And then, yeah, I saw that your guys' podcast and I binge listened to everything. And you
You
guys are
do?
putting
What's
out
been
some
your
good
favorite,
stuff.
Jenny? I'm gonna put you on the
Oh,
spot.
ooh, let's
And
see.
if you want
My
to circle back,
favorite.
because I hate when people do it to me, like, hey, what's your favorite this? I'm like, ugh.
Yeah,
You
because I'll
know,
tell you I listen to your podcast and I don't actually listen to it. Like, what's your favorite? I'm like, the one
oh boy.
about brown
You
bears.
know, that one we all talked about that stuff?
Yeah, the
Brown
stuff that
bears.
was really cool. I gotta be
Yeah.
careful with that.
But Jen,
You,
is there one that's made it like helped you or helped move the
Or a
needle for
concept,
you
even a
or anything?
concept.
Yeah, concept or
ooh,
anything.
I think, one of the things that I really like, and I'm going to forget the doctors that talked about it, but I think it was a lot of looking at the practice in a sense of, okay, what do you want and what are you going to change to get there? And you guys have a lot of insight in terms of like owning your practices and building the practices. I think you
Mhm.
actually had like someone new coming on that was going to be going into owning an office.
Yeah, it's Dr. Trey. He was trying to look probably the startup process, right?
Right. And I
Yeah,
thought
yeah.
that was really good insight because it's funny, I was actually just talking about with a colleague that, along the way as we're growing up, we're told what to do. Like you go to school,
Mhm.
you get good grades, then you go to your high school, and then you go to your college, and then you go to grad school, and then you graduate and you're like, okay, well, what's next?
Wow, no,
You
what,
know?
right.
And so as like being someone who's been practicing for like 5 years, you're always thinking like, what's next? What's the next step? And it's good to hear from people going through that process. It's good to like break it down. And then it was also good to hear from some like other docs. I remember one of the docs was saying, not the same one, he was talking about how like if you want to double your production, then you need to treatment plan more and like
Mhm.
see the bigger picture. And
Mhm.
it's like, as a new doc, you can get really overwhelmed as like the conditions and everything, but if you're looking at the bigger picture, looking at the whole forest, not just each individual tree in that forest, you're going to be able to see more, and the patients need it.
Mhm.
You see those patients that they have just horrible dentition going on, and they're maybe in their later years, and it's like, okay, where do we even start?
Right. And
And
it's
so being able,
overwhelming.
yeah,
Right.
and being
And then
able to look
so
at the big picture.
and then yeah, and I'm going to touch on that because I think this is amazing what you're saying is being able to see a big picture. And then most importantly and probably more difficult is being able to communicate that back to the patient in a
Right,
need-based thing that benefits them, right?
right.
Without it being like as opposed to just getting all dentally and like being like, you've got this, we need to do this gross debridement and number 3 in the distal here. Like, right? Like dentists default
Mm-hmm.
sometimes to like getting real technical because it makes us look smart. And like, oh,
Mm-hmm.
doc, you're smart. But that's really at the end of the day, it doesn't move the needle in terms of engagement or enrollment.
Right.
So
Yeah,
that's
and
cool. Thanks
there's a
for that.
philosophical dilemma too that I just came back from a conference this weekend, and there's like a philosophical dilemma that needs to be resolved as well. And the philosophical dilemma is if you have a patient that has diseased, and you have the power to help them fix it, you owe it. There's an injustice if you don't convince them and get them to do it. So you got to, because a lot of dentists don't do what they're supposed to do because they have their own needs and fears wrapped up in that. I went to this story brand conference and there's all about the hero and the guide, and Pete and I talk about this crap all the time, but dentists want to be the hero, and the hero never wins. it's the guide that wins. The guide, it's Yoda, and it's our job as dentists to
But
help.
how much in your career, Craig, sorry to interject because this is important, how much in your career did you try to be the hero?
Always. I still try to be the hero. I find myself trying to be the hero even today. And I'm like, shut the, I literally, I've done this twice today in front of people. I'm like, I'm really sorry. I don't even want to talk about this. I'm sorry. I have nothing to add because it's not good to be the hero. Everybody's got to be their own hero. But what I was trying to touch on is that if what we do is good, so if you're a good dentist and you've refined your craft and you've put your time and skill into knowing how to take care of people,
it's your professional duty.
It is your obligation to help patients and tell them exactly what's going on. Let them make their own decisions, but take yourself out of it. Don't get this fear of rejection. Just tell them, like, listen, you've got malocclusion. You've got an edge-to-edge bite. Maybe it's not going to happen.
That's a hard thing.
It is.
We go for the layup. Human nature says, where's the easy button? Let me go for the layup. I'll enroll the crown of the month. And
no, don't do that.
No, I'm not saying that, Craig. I'm saying
I know, but it's so visceral to me. I have to say that don't do that.
Okay.
I'm talking
just to make sure we know how you feel.
Yeah, I just don't think you should do it.
Something that you brought up, Craig, that I realize is that, you have to be able to have those conversations with patients. And our goal is to always explain the condition, explain what's going on and offer the solutions for it. But it's the patient's choice. And if we're neglecting something, all we're doing is neglecting, and we're not talking about it because of our own fears. We have to get over those, because the worst that is going to happen, the patient says, you know what, I'm not going to do that. And then maybe that tooth ends up breaking, and then you see them again and they're like, you know what, you were right. I figured this was going to happen. You already talked to me about it. And so getting over that hump, especially, that's something that I've learned more and more just early in my profession of, like, you have to be willing to have those conversations, even if you can tell the patient doesn't want to hear it.
And also, and when you're young and inexperienced, you realize you don't know it all, so you're insecure, and you feel the need to have the right answer. At a position that I'm at, and probably you're reaching it now, I tell patients I don't know. I feel comfortable telling patients I don't know. I'm like, you have a crack in this tooth. I don't know if it's going to break. If it was me, I'd fix it, but I may tell you to fix it, and 10 years goes by, and you're like, oh my God, Craig Spodak was so aggressive, he wanted to fix it. I just don't know. Or it could break tomorrow. So I don't have all the answers, but I have an obligation to tell you what I see. And if you know what I know, then you make better decisions about yourself, for yourself. So I think it's really important.
But Jenny, you brought up something too. Like, sometimes they come back later. So maybe a no. And I think so many people are so petrified of a no. Like, I spent all this time presenting and they didn't do it. So that means it's a no. And it's really just not right now. Right. Maybe it's just not right now. Maybe it's I need a little more time or whatever. So yeah, reframing the narrative on sometimes what we think about successes and failures on that aspect, maybe. It's cool. So how are you the yogi dentist? Like, what's going on there?
Yeah. So I started that Instagram actually when I moved to Austin. I started it probably in Jacksonville when I was practicing there for a couple years. And it was just a way to get on social media, present myself, and kind of break that barrier between doctor and patient of, like, we go to the dentist. How many times have we all heard, like, I hate the dentist, I hate you, no offense, it's not you, and I wanted to kind of break that narrative and be able to open up more to my patients. So I started to just post maybe cases or my life so that my patients could, if they stumbled upon my Instagram prior to meeting me, that they could get to know me a little bit. From there, I evolved it into more of, like, education. So I try to touch on certain things dental, not overload it with dental. I think that the general public doesn't love teeth as much as dentists love teeth. So I will talk.
Fair assessment.
Exactly.
What is that, Craig?
I just pulled up a post.
Oh, there. That was me. That was taken on an iPhone, actually.
I know it doesn't give me.
Wait, that was you, Jenny?
Yes. Those were pictures that I've taken.
That does not look very yogi-ish, by the way.
Well, no, there's some other yogi stuff in there. So you'll see that, and then you'll be like,
to see you more in handstands and stuff.
Yeah,
like
so you'll see this beautiful smiling, smiling face, and like, oh, by the way, I'm gonna rip your fucking tooth out. How do you like that?
Zen
come over. I'm approachable and nice, and I'm into yoga. Oh, and by the way, I'll pull all your front teeth out.
It's like a wolf in sheepskin clothing.
I know. I think it's because
I like her, but I'm scared of her.
Right,
I don't know what it is.
It's funny that you mentioned that. I've been trying to move away from as many bloody teeth as I've been posting and move more into like cases and cosmetics, you know, the pretty stuff that people like actually want to look at.
Yeah, there's such a beautiful feel to your page, and it's immediately
Thank you.
disarming because you could tell your spirit of who you are comes through into your pictures, and you know, such as disarming thing, which I think is great, because I do believe, unfortunately, most people view the dentist as a horrible thing they have to do, and I think it's incumbent upon all of us to give dentistry a new name and a new brand. But at the same time, when you see that and then you see this, I'm like, oh shit, that's scary for me. You're not seeing it properly. Look at that.
Oh, I see it. I see. Yep,
it's like I will disassemble you limb by limb, tooth by tooth, and then array it out in artistic fashion for you.
But just make sure to breathe through all of
right,
it. You know?
Right. Get your Ayurvedic breathing going.
Exactly.
Oh, Pete, I gotta go off on a tangent just for 1 second. Okay,
Shocker.
Just 1 second, because I always do this. So, are you aware, Jenny, and I'm sorry if I'm boxing you into a stereotype here, but are you aware of prana healing? Pranic healing. Are either one of you aware of this?
Yeah.
Okay, so
from a breathing aspect?
So I don't understand any of this crap, right?
Pranayama.
So one of
Jenny.
Tony's people is a guy by the name of Master Stephen Coe. You can follow him on Instagram, Master Coe.
How do I get that name? I'm tired of doctor. I would like to have master.
Would you like master?
I would like master.
I don't want to be master, actually, because there's a whole bunch of jokes that could come around that. So I don't want to be a master.
Okay.
Anyway, so Master Coe came to my office because he needed like a dental checkup. He was here in town or something like that. And I did something for him. I helped him out real quick because Tony had his date with Destiny. And I don't know, Peter, if I told you this, but I've been hobbling around for like 2 weeks. I've had severe knee pain. I don't know what the hell happened. My dad told me when you go to bed fine and you wake up injured, you're officially old. And that shit happened to me. I woke up and I fucking couldn't walk. And it's been driving me crazy. So much pain, I can't even sleep at night. And so I help this guy out and I say, hey, he's like, what do I owe you? I'm like, dude, it's my pleasure.
Jenny, Craig has the pain tolerance of a 4-year-old. So it's
like a 6-year-old. I'm a guy.
A little bit of pain then.
Well,
ahead,
I mean,
Craig,
for me, it was debilitating.
Listen, this is a little dramatic, but go ahead.
No, it was debilitating.
No,
it doesn't matter
just
what
like the splinter was at my lake house this summer. Like,
no. So I was wakeboarding and my ring cut into my hand. And I had a nice small blister. It would have been nothing for either of you, but it was debilitating there too because I couldn't wakeboard.
Right.
So anyway, don't try to disrupt my story. It's
Craig,
actually really cool. It has nothing to do with dentistry, but I'm just feeling like I just saw your yoga post.
Pranayama, go for it.
Your hashtags and stuff like that.
Master Cho.
So Master Co. So I said to Master Co, I'm like, hey, listen. He's like, what do I owe you? I'm like, nothing, but could you hook me up with something? I'm like, my knee's been killing me. He's like, yeah, I'll take a look at it. I'm like, well, I'm kind of wearing like long pants. Like, I don't know. He's like, no. Do you know what I do? I was like, no, but I know you're Tony's boy and like you're going to get on stage with 5,000 people. So
and your master. Your master.
Master. Yeah. I mean, shit. Like if you called me Master Invisalign, people would be flying in. So anyway, so he sits me down and he says, I just want to make you aware of what I do. I don't touch you at all. I just, do something. So it was weird. So he sits me down and I don't know what he does. So I close my eyes because it's kind of strange to have somebody like doing weird things with their hands. I could feel stuff all around me. And Peter and Jenny, if you told me this story, I would lose all my respect for you.
Oh God, please.
Like if Peter, you told me I went to a doctor and said, or a Chinese prana healing person, and I walked out with my knee feeling fine, that shit happened, bro.
Mm-hmm. Yeah. Well, placebo is a powerful thing, pal. So
mindset, having that mindset.
Okay, so both of you are saying.
So he broke out his magic wand and healed you, Craig. Is that
I believe you.
No, just hit me straight. Hit me straight here, Peter. I know where you stand. You call bullshit, Jenny. Where are you at with this right now?
I mean, I believe
you don't know me, but I would never.
You would never lie. So, I mean, I believe you. I do. What I was saying, I truly do think that our mindset and like what we believe really manifests for us. And so perhaps it really helped you. I don't have experience within that and it healing any of my ailments. So I guess I can't speak
I'm just telling
directly.
You, this guy, like it was like a healing episode from the Bible. Like I walked in Nashville, I did 4 or 5 days with 15,000 plus steps and it doesn't hurt anymore. And the guy just like waved stuff around me. It's crazy.
That's great.
So use code Spodak. No, I'm kidding.
Yeah, right. Nice little segue to an ad.
I'm totally kidding. That's a total and complete joke. I don't have anything to do with it. It's just amazing.
So for those of you who are interested in the course,
right? Exactly. Right. No, there's no plug. He doesn't.
He's not sponsoring the podcast, Craig.
None of the following. I don't know what made me think of that. I saw your bloody teeth and I saw your yoga poses. I
It's
just
too funny.
really what it was is I just haven't talked to Pete in a while because I've been traveling. So I just wanted to get that
And
out.
the other thing is, Jenny, he just can't help it but to be like, oh, wait, let me talk about something totally unrelated to this.
I feel
love
like it
this.
added some value. It might be
It
prana
did. It
dentistry.
did.
Jenny,
It did.
prana
And
dentistry.
any
Listen,
opportunity for me to make
I'm
fun of
getting
you
all
is a
these
great one
ideas.
too.
Yeah. You have a toothache. Just breathe.
I can't wait to make fun of you like from this story going forward. So this is great.
This is wonderful content.
So you know what I'm really excited about, Jenny? I'm really
What's that?
excited about having a female dentist on. I
Yes.
really think it's important, just because
Why,
I
Craig?
think. Well, I just believe that I want to just talk about it for a second. I want to
All
talk about the dynamic that I think females have in the workplace, in dentistry and healthcare. You know, my daughter, my wife works really hard. She's a great role model. She's beautiful, works out, works hard. She's always worked her whole life. So my daughter is growing up with a really good, strong female role model of what you can be if you're everything. Super mom, super wife, super career. And it's really hard. And my daughter said something the other day, like it was a sex bias. It was almost like, and my daughter's really strong and very feminine, very powerful, but she said something like, that's for boys and that's for girls. It was like when she was 6 or 7 years old. It was a
Right.
while ago. It wasn't just the other day. So what I'm trying to say is that there is this bias. And I find that, you know, when I I'll invariably meet a hygienist and they'll say, oh, I went to work for this female dentist and she was such a, you know, she was so strong, she was bitchy. And I'm like, and I'm just hearing like that same characteristic on a man might be affirmative, strong, strength. And I just think I want to salute you for being not only, you know, a powerful force in dentistry, but a female powerful force in dentistry. I think that deserves a special level, because if you say something, I'm a tall man, I say something, people will get upset. There's biases, human beings have biases. And I think it's just important that to just touch upon what it's like as a female dentist, a female associate, female office, female owner. I want to hear about your perspective from that.
Right. Yeah, no, you bring up some really good points of definitely things that I've even noticed being in this profession as a female. I think that, you know, you were talking about how your daughter was saying, this is a boy thing, this is a girl thing. I guess my first realization of things might be a little bit different for me is when, you know, going back into dental school. And it always would be a running joke with our friends, because anytime someone would see us in scrubs, they would ask if they were a nurse, if we were
Right.
nurses. And no offense to that, nursing is a fantastic career. There's nothing wrong with being a nurse, but it would upset me and my fellow female dental students. And what I've realized is that the reason that it became upsetting was because of any preconceived notion that you may gather from me just from being a female, right? And so that has carried on within even the profession. And what I've noticed is it's just different, right? We all face challenges in life, and being a female and trying to be a leader, we can easily teeter on the, you know, men are assertive, women are bitches.
Right.
And I bet if, you know, we could probably poll some of the staff or teammates that I've worked with, and they may say the same thing about me. So it's been a lot of character reflection as well, and perhaps a lot of development on my own to be able to be assertive, but continue to have a good working relationship with the team, you know? You also said that your wife is really strong, and I have to give kudos to my mom. She's very similar. She worked her whole life. She was a full-time mom. Like, my mom and dad are still together, so there was co-parenting there. But, you know, there was never a I can't have it all or I can't do it all mentality.
That's
And I
awesome
think
you had that.
yeah, and I think that's really trickled into me pursuing being in this profession, being a leader, and saying I can have it all. I just have to figure out what it all means to me.
Yeah, I just think it's an interesting dynamic, and one that I always think about. My wife gathers her self-esteem from being productive and stuff like that. So like but I do, she doesn't like to, she won't talk about it, because my wife is just like, I just do, like, I don't care.
Right.
She's just a doer. But I can sense a lot of pressure on her to be level 10 mom, level 10 wife, cooking dinner, working out. So she wakes up at 5:30, works out, cooks dinner in the morning. I wake up smelling like sofrito and garlic. She's Puerto Rican, so I'll smell like food for dinner. And I just think that you add that in. I was talking to a female dentist that's in my area. Her name is Dr. White. She's super, super sweet girl. And she has 5 kids and she's dealing with all the stuff I'm dealing with. And I get this pass. As a guy, I get a pass because my lane is very well. Men have this preconceived bias as well. Just do your job, be a man, be blah, 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 get it done, bravado. And like, we just stay within those confines and we're golden. But a woman, you work a little too much and you have a nanny picking up your kids now. Oh, you're like, what are you doing? Like, you're not a good mom. You're too much of a mommy. You're not working. You're a gold digger. It's a very tough thing.
It's a tough little line. I agree.
It is. And in order to do it perfect, it's really hard. And I think there's a lot of women, especially career women, that probably are struggling with that dynamic.
And I do think, it's become a topic now, which I think is the first step, right? And, I don't currently have children, but within the next few years, I may be planning to have them. So I've been thinking a lot about that moving forward. Like, what will my work-life balance look like?
Right.
And I don't have all the answers, but something I have noticed, even just with all of my friends having kids and many females that I know in this dental profession that do it all, or it seems like they do it all, they run practices and they have families and they're successful at both, is that at least we're talking about it. And we're not pretending that, oh, we can just handle it all, don't worry about it. And I think the conversation is becoming more prevalent, and it allows for a lot of women to then be able to kind of strategically plan. So I think dentistry affords that opportunity though. My goal is to set myself up so that if there is any moment where I have to step away I'm still able to have my profession. I've worked really hard for this. I don't really want to leave it on the wayside as I transition into motherhood. And so to be able to be in a career that affords me that opportunity is really important. And my goals in the next couple of years are to really set myself up to potentially have some passive income. So that way I don't have to be chairside every second of every single day to be able to raise my family.
So Jenny, touch upon like how that affects your particular views of associateship versus ownership and stuff like that. How does this equation fit or this thought fit into that equation?
Well, I've been an associate for 5 years, and it's something that I very much have enjoyed, and I've learned and I've grown. And there is ownership going to be in the future. At least that's where my mindset is. And I think that does offer opportunities. Now, on the flip side, it also brings up concern, right? Because then you have another baby. You have your office baby. And so, having to strategically plan that, my fiance and I have had many conversations about this. He's an orthodontist, and so we're both in the dental profession. And what we've talked about is, where can we gain the help? Will it be with nannies? Will it be with parents? Will my schedule, I still work, but perhaps we cut some days short so I can go see the kids.
Can I ask you a question, Jenny? So why do you want, I heard you talk about freedom and passive income. Are those the drivers for you wanting your own autonomy of your own practice? No.
I'm a very independent person. I always have been, and practice ownership has always been in my sights even before starting dental school. When I was picking a career, it's actually funny. I was talking to my brother, and I had mentioned a career that I wanted to maybe pursue, and he's like, "I just don't think that's for you. You don't like being told what to do." I like to have my own narrative. And so I like celebrating my successes and the successes that come upon me. And I honor my failures, and I can take full ownership for them. But what I don't like is feeling failure based on others' decisions.
Being in charge. Yeah, I love that. That's a great, the reason I ask you that is I ask a lot of people that because, and Craig and I push on people a little bit for, sometimes we get into this copy and paste narrative of like, well, I want to practice because like they told me that that's how you get X, Y, and Z or do whatever. And it's really, you have to be really, your why has to be super powerful, right? With what you're doing it. Cause there's it's not, some people have this myth that like, I'm going to get my own practice, I'm going to make more money. Actually, that's not always the case. Sometimes it can be. And in time, that gets better and better. But like from the get, you have to be prepared you might have a year or two without pay, actually, in certain instances. It just depends. So I don't know. I love having these conversations because I think it's important to expose things for what they are. And sometimes
Well, I
being an
think it's
associate is the best thing, and sometimes ownership is the best thing. It depends, but you have enough self-awareness is what I'm gathering from you. You know who you were prior to dentistry, and so you have enough self-awareness to say, hey, I'm not going to be a very good second in command because I want to own the successes and I want to honor the failures. Like you said,
Right.
honor the failures. It's almost like, Craig, that's what Master Cho would have liked, that honor the failures.
yeah, Master Cho likes that. I think she likes it. Master
So
Co,
you have
by the
enough
way.
self-awareness. I think that's a massive, massive component of your vision. So,
But I also do think we have a fatal flaw in that we pursue
speak for
goals.
yourself.
We all do. I see it enough. I have enough people in my circle. I see this this recurring theme in human psychology of you pick a goal, you achieve the goal, and you get it, and you're unfulfilled. And I just think that, like you spoke about, Jenny, you said, I was on this track. I went to this, I was to do this, I was doing this. And now all of a sudden the rail track just opened up into a trifurcation and whatever, a whatever, 10 different routes. I was about to say a decafrication. I like that. That route is decafricated. So 10 different routes of like, okay, what's next? And then somewhere along the line, you came up with an idea of, I should be an owner because I like to honor my failure. That's a narrative you made for yourself as well. And that's a narrative I made for myself. Somewhere along the line, I'm like, I'm going to build this 18 operatory, blah, 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 and fuck all y'all. That's like, must have come into my head at some point.
Right.
And then I got here, and if you've read the book or listened to stuff, and I was like sitting at this very desk crying my eyes out. And so I pursued a goal that I didn't quite understand. I just kind of did it. And it took a lot of resolution of conflict and understanding to realize, why did I want to do it? And the reason why I did it, the apparent reason, was really an internal reason that was expressed differently. So what does that all mean? That just means that you don't really know your own self as well as we all think. And that's what sets ourselves up as an internal fatal flaw. We pursue goals that we think are going to be happy. I have a buddy of mine that just exited a company. He's freaking miserable right now. He was making 200 grand a year, and he now makes 500 grand a year and has like 8 million in the bank. So for a guy making 2 million a year at 60 years old, he's doing really well, and he has no fulfillment left. He's turning into a total jackass.
Right.
So I just think it's important for all of us to think about that. We're all susceptible to that fatal flaw of pursuing something that we don't really want or love. And I just, I hear that a lot.
The point that what you were saying is we work towards these goals, right? And I think the issue and the problem is that we look towards tangible goals, and then we receive that tangible goal and we go, that didn't bring me happiness. All right. So what's the next thing?
Keep going. Or
Exactly.
or what's next?
Right. And so what I try to do is set goals that are never attainable, right? Kind of something that is a fairyland idea. So I use the word freedom. Well, what does that mean? Well, if I want to go ahead and take a trip, have I worked hard enough to be able to go and take that trip and be able to decompress, because travel is important to me? And I'm continually thinking about those goals. Actually, to bring it back to yoga, yoga really helps that. And I've learned that through yoga is that I don't really know myself. That, and also talking to a therapist every few weeks, of like truly trying to understand myself so that I can be a
Jenny,
better
would you feel
person.
comfortable telling us or the audience of what drove you to seek the therapy? What was the
I'm an open book.
If you don't, and you feel free to say, I always ask inappropriate
I think
questions.
this is beautiful.
No, I'm very, very open. I initially had started therapy. Well, first, I've always been interested in therapy. I used to think I wanted to be a psychiatrist. So it's always been something that's been very interesting to me, the human psyche.
Me too,
And
big
then,
time.
yeah. And then in dental school, I sought out therapy. I was going through a really tough breakup, and that was probably my first experience at therapy. And what I had realized during that was, holy cow, I don't really know myself. Kind of like what you were saying is, why am I having
liberating.
It is. Why am I having these reactions? What is causing all of this? And how do I move on from it? I had taken a little bit of a break with therapy, and over the years of not speaking with a therapist, I realized that a lot of stuff would just come up, and maybe I wasn't handling it in the way that I wanted to. Maybe I wasn't developing relationships in the way that I wanted to, or being authentically myself in the way that I wanted to. And so I sought out therapy again, and it's been monumental. I would say in this last year working, I have been faced with a lot of instances where I went home and said, wow, I could have done better. And that was a really hard spot to be in. And what I realized is you sometimes have to seek that professional help to be able to talk through things.
So just a quick question, that thought of I could have done better, does that mean I'm not proud of the way I acted today? Or does that mean, I just want to know what that means to you, because I want to.
You know what it really actually was is that I was in this last about year and a half, I've been faced with the challenge of being a very prominent leader in the practice. So, and there were moments where with the team where I felt, I probably could have had a better conversation about that, or we could have handled that a little bit better, gotten to a better resolve. I'll say, like, when I was working at a couple of offices in Jacksonville, there were some really strong leaders in position. And so what I found was I was very heavily relying on them to lead, and I was able to kind of walk in and do the dentistry. Contrarily, now I felt like I was in a position that it was time to up my leadership skills. And in my time in being a dentist, I've really gotten good at my dental skills. And now is the time to really, really focus on how to be an effective leader for the team and create the culture that you're really looking for in the dental office.
That's cool.
Great.
I've
really
had,
great.
I think that's
a lot of growth there.
Just you're speaking of high emotional intelligence, and that's a great thing. I mean, the curse of being aware, but also the blessing of being aware. Like I've gotten home so many days where I'm like, oh, I can't believe I did that. That's hence the reason of the zip it. Like I've gone through enough pain to, my goal is I want to make everybody feel better. And sometimes you say things and you mean them one way, but they land on somebody else. And there's two ways to look at that. I mean, communication is really your fault no matter what. So if someone's upset with you, you communicated poorly. The best people in the world, the people who have the highest quality of life, are the people with the highest level of communication. And it's a never ending process. I was just curious about what drove you to that.
Of course.
And then there's therapy, but there's also like training. So what training are you doing? What leadership training are you doing?
Well, I try to read books. I really try to go to that a lot. I've also talked with my therapist about a lot of opportunities in which maybe I could communicate or maybe stifle emotion. That's something I noticed too with females in the profession. Notoriously, men are more problem solving. Females can bring more emotion in, and that comes from doctors, team members, patients, doesn't matter. And to be able to work through those emotions, make sure that they're not controlling behavior, but rather acting in a sound mind to be able to make the appropriate decision-making decisions. I know that was basically to get to the solution quicker. And that's been mainly my biggest goal of this year, is making sure that we're communicating. You're so right. It does come out to communication, and how you communicate with your partners, like at home, is not going to be the same way that you communicate to your assistant, to your office manager. Everyone has personalities and they communicate and receive information differently. And so that's been a lot of work that I've actually done with my therapist.
Cool.
And then other than that, I try to, read books along the way that kind of help with that. Good to Great, or my fiance read one about like emotional intelligence and everything, and we'll try to share at the dinner table and go over those things. That's awesome.
Yeah, Good to Great was a really good book. That's awesome.
Really good book. I think my favorite quote is, you got to get the right people in the right seats of the bus. And then you drive the bus.
Exactly. And just because they're in the wrong seat doesn't mean they don't belong on the bus.
Right.
Know what I mean?
You just have to find the right seat, and then they excel, and then the office or the team excels.
Yeah, and then in my office, I know Pete has a slightly different dynamic, but I have a very predominantly female environment, mostly female team, mostly female doctor. So it is.
You have female energy, so it's perfect.
So it works out really well for you.
Yeah.
It is.
God, I don't care. Listen, we have a female guest on, so it's probably a compliment.
It really is.
Listen,
exactly.
we all do have masculine and feminine energy, and the truly effective communicators access all of it. You have to access all of it.
But Greg, that is why you really are a great communicator, right?
I try to be.
Not only just in clinical stuff. See how I have to, Jenny, I bust on him and then I come back with this.
Yeah, because he sees the hurt. He sees the hurt.
I do. I'm like, God, that probably hurt his
exactly.
feelings. Like,
it's part of our bromance. It's like how guys express their love for each other.
Right, exactly.
They have to punch each other. Oh, that's weird. Yeah, you have to like shrug
beat
it
around
off.
the bush a little bit.
Yeah, exactly. I'll just have no problem. Like, Peter, I love you, man. You're always there for me. I love you, bro. He's like,
oh, stop. This makes me uncomfortable. Stop this.
That's too funny.
So what else? What other stuff are you doing? And obviously, how many days a week are you practicing? Are you teaching yoga as well, or just practicing?
Wait, I have a question that I've been waiting to ask.
Yeah, sorry, I'm dominating.
So no, it's okay. It's good. Your morning routine, like So how long of a? Two questions, I guess. What is your routine, and then what advice can you give for someone who is doing nothing? Right, like how do they eat the elephant one bite at a time, and like incrementally, like what's the best use of 5 minutes in the morning?
Okay, well, I wake up at 5 a.m. every morning, and I either do a workout. We have a gym at our house we made. It's called the Iron Molar. There's a flag up and everything.
Little reference to Dwayne "The Rock" Johnson.
Oh, how could you tell? My fiance is obsessed with The Rock.
Well, I don't know your fiance, but if it's the Iron,
it's a play off of the Iron Paradise for sure. Yeah. But yeah, we named it the Iron Molar. We have a Doberman too, so he needs a lot of exercise. Wow. So it's nice to have that home gym. So I either work out there or I'll go to Pilates. It's always
Isn't it Pilates? It's Pilates, isn't it? I'm so sorry. I'm sorry. I'm going to tune out for a second.
So or I'll go to Pilates or I'll do something. So I get questions a lot of times, maybe on Instagram. It's like, well, when are you finding time to work out? And what I find is that if I do it in the morning, there's no excuse in the afternoon. Right. You know, we all have those days where like, we're just beat down. All we want to do is maybe veg out, go to bed early, like not have to like focus on working out. And then it becomes a cascade effect of days after days of not working out. So that's my very first thing that I'll always do in the morning. From there, I try to get ready quickly to get to the office. And usually I'll try to put on a podcast or an audiobook that'll kind of set the tone for the office. And anything that I maybe learned via the podcast or audiobook, I'll try to bring into the office in terms of a talking point at huddle or something that we can focus on for the day or the week ahead of us. I have in the past tried to meditate in the morning. I find that's really helpful. It gives a good, nice little mindset. You ask what's a good thing someone can do for 5 minutes, and it's just to meditate, clear your mind. We get really, really busy during the day and not too many moments to ourselves. Yeah. And so to really sit there with yourself in silence and be able to calm the mind really gives a good energy for the rest of the day. But I would say do something good for yourself when you wake up and not immediately look on Instagram or at your emails or anything that's technology, because that can easily put us in a different mind space that we don't want to face the day with.
Yeah, more of a shot of adrenaline or fight or flight reaction in the morning from looking at your email.
So I heard a really interesting statistic about another study that just came out. Of course, you can do a study that matches any outcome you want, but there's some good data from what I'm understanding about just like how people feel before and after Instagram specifically. And overall, just across different genders and different socioeconomic variety, you have a less fulfilled, less happy feeling after, which is so interesting. It's so addictive and you're not happy. So it's an interesting, it's a perfect drug. Actually,
well, it can easily feel overwhelming. I've actually, heard of a lot of things, or I'll get messages and people will say, and a lot of times it's like younger docs or people in dental school, and they're like, "How do you do it all?" And I'm like, "Well, I don't always do it all well." Like we put on Instagram our highlight reel and what we want to show to the world, but I'm not putting it on here, all my failures, no one wants to really see that, or maybe we do, maybe we need to start showing our failures. But I think it's easy for people to feel overwhelmed. And I've even felt overwhelmed at times. There's a lot of dentists and docs on Instagram, and you'll read the captions or you'll see the work and you're like, man, they're so good. Like, I want to be that. And it immediately can put you in a bad mindset or it can motivate you. And you know, success leaves clues. What have they done? How have they gotten where they've gotten? So it could be twofold, but I can easily see the trap of falling into negative mindset and like negative talk from Instagram.
Yeah, I think it gets us looped in because it's community, and human beings
Mm-hmm.
crave community and camaraderie, but it's a false community. It's not your
Right.
community. These are people that many of them you don't even know, and
Right.
when you're sitting behind a keyboard or behind a screen, you get some pretty aggressive comments because people would say things to you on through Instagram they'd never have the ability or confidence to say in your face. I did something really cool. I was in Nashville this weekend, and I don't know why I'm going so fucking tangential today, but I guess I always do. But I went to this place called Monell's. It was a Southern diner, and I didn't know. I just looked it up on Yelp, and it was really well rated. So I went over there with Norm because we were there together, my buddy Norm. And I get there, and it's communal tables.
Mm-hmm.
So I'm sitting with like a 12,
Nope.
12 person
No way I do
African
that.
American beautiful family with the kids and the grandkids and the patriarch of the family. And it was so beautiful. And you're like, hey, pass the corn, pass this. And I was just thinking to myself, I actually said to everybody, imagine if we all had required to eat dinner with just random families, just different people from all walks of life. I said the world would be such a better place because
Mm-hmm.
you're not allowed to use the phone at Monell's. You can't even
Right.
have your phone on the table. Why are you rolling your eyes?
This place sounds horrible.
Well,
It's
I
hard.
didn't.
It's a hard hump to get over to, like,
So,
you know, those
so,
times
but
where you show.
I'm gonna go on and give it bad Yelp reviews right now. You
No,
go
but it
ahead,
was
LinkedIn.
so freaking awesome. It was so inspiring for me to be at this table and be with all these different people. There's one girl, she was from Australia. She was traveling the world by backpack. And Norm, I lean over to Norm, I'm like, hey, dude, let's just get up and go pay for the whole bill, pay for everybody. And then we'll not even let them know who did it.
Mm-hmm.
So I go out to the bathroom and I give the guy my card, and they're like, they couldn't understand. Like, you're making a big scene. Like, just, I want to take care of the bill and don't tell them I did it. So I sign the credit card and I come back and everybody's like, I'll break it up. Like, hey, nice to talk with y'all. And like, let's get the check. And like, when do y'all pay for it? And I'm like, oh, I wonder who it was. We just walked out, but it was the most beautiful thing because it was real community. It was real community. And that's what we all need. We all need that no matter what level you're at. We all crave community. I know at my level, I crave community. I have very successful, super successful friends. They're dying for community, and we don't have that. And I think Facebook, Instagram, and those areas that we can actually feel the nuances of community don't really have it. And that's the trap. That's why it leaves you more frustrated. And
I can definitely see that. I was just at the DIA conference though, and I do have to give credit for the fact of what it does have the potential to do, right? You get together, and you guys were there last year, am I correct? Yeah.
yeah,
And so
it was awesome.
yeah, it's great, and it is those stepping stones for the community, but to be able to gather and actually get to know each other beyond their Instagram handle is where the real beauty and essence of Instagram can be beneficial, right?
Right.
And
It's the
so,
tool to get to
right,
community. It's not the
exactly,
community in and of itself. That makes
exactly,
perfect sense.
yeah.
But that takes
It's
a lot of heavy lifting on those guys that are doing
Oh, for
DIA.
sure. No, it was another really great conference.
I heard.
They really knocked it out of the park again.
And
It's
everybody
in
got to
Atlanta
see
next
Bloody.
year.
I know.
I congratulated Bloody Tooth Guy at his coming out party.
Oh, I know. What a
Yeah.
big deal.
I know, it was awesome.
Craig, you know DIA is in Atlanta next year.
It is.
Yeah, I'll be there. I'd love to
Yeah.
be there.
You should come watch me speak, Craig.
I would love to.
It'd be awesome.
You would do really well. I'll
It would
heckle
be
you.
awesome. It'd be awesome. I've already been invited, so I figured I gave you a front row seat there, pal.
There you go.
So tell me though, what would be any advice that you're giving to one of the people that follow you on Instagram or someone that's listening to this podcast? What's the one thing that you'd like to talk to them about or give them a piece of advice, if you could?
I think that a topic that I kind of touched on with younger docs getting like overwhelmed is that just don't get overwhelmed. Take your goals. Look at where you are today, right? You know, maybe it's your first day in private practice or a group practice. Look where you are, see what goals and what you need to accomplish as a doctor. Do you need to learn more in your field? Seek out those CEs of the topics that you enjoy. So for me, I like surgery, I like cosmetics, and I really, again, want to see the bigger picture more and more. So I'm finding those CEs that are going to give me that education. And take yourself day by day. don't look at the people on Instagram and think, oh my gosh, they just had this all overnight, right? Understand that they started from a certain position. They too probably walked in their first day of private practice and was like, oh my gosh, this is so many patients. Like, how do I do all of this? And then I have hygiene checks.
Or
and
there's
I
no
have all these
patients,
things.
whichever
Or
one you
no
were.
patients. Well, that is true. I guess I was the opposite, where I went into a high producing office. So it was like, all right, we got to do some work. You know, I think I spent my very first day in private practice. I was there until about 9 p.m. at night because I couldn't get the CEREC. I was doing a root canal and crown with a CEREC and milling unit same day. And I was just slow. I was just slow. And thank God for that assistant, because she was the rock star of that day. She kept me together. But it was eye-opening of like, you just have to grow every single day and not let everything overwhelm you. And as my trajectory has happened, I've gotten more and more comfortable within the dentistry. I still have a boatload to learn and grow. But then I started to, like we talked about, focus on my leadership. And I think a lot of our successes in this profession will stem from our leadership, how we lead ourselves, how we lead our team, how we lead our patients. It all stems from our communication and our ability to lead. And those skills we don't really get from dental school, right? We don't learn that. So taking it upon yourself for personal growth, whatever that looks like, and making sure that you're dedicating time and effort for your growth. And inevitably, I think you'll see your relationships and your career kind of take off from there.
That's great advice. That's awesome advice.
Yeah, and what you've been doing is, no different than your clinical skills. And people think that leadership is not one of those things. You have to flex that muscle the same way,
right,
that you would do, just like you would your business acumen. You have to get at bats. You have to take reps. You have to figure. You have to make some accelerated mistakes.
Right.
Mistakes, which are accelerated learning. So, but I think a lot of people are just like, well, I just want to know like the path, 'cause I don't want to make these mistakes. I'm like, it's inevitable. Like, you're just going to, and that's okay.
You learn most from that. You know, if you look at all your successes, you just think like you're the best ever. I was actually watching the documentary last night, Bill Belichick and Nick Saban. Did you guys happen to catch it? Oh, it's good. I recommend it. But I think it was Belichick, and he was like, those seasons where you're just winning all season, you kind of wish you had a loss, because then it makes you realize that it won't always go perfect. And it was like, that is so true.
It sounds like a Belichick Brady thing to say. Like, of course you get to say that. Like,
yeah, exactly. The most winningest team ever.
Sure.
Of course,
Jerks.
of course. But the tone of it is that you're going to learn from your failures. And as I was saying before, this year, my leadership has been slapped in my face. And there were definitely moments where I felt like a failure. But looking back, I'm like, thank goodness, because now I know how to have those tough conversations. I know how to approach them so that next time we can have a better result.
Hey, how far is Austin from Houston, guys?
It's a hike.
A few hours.
It'd be cool to have you. We have our summit coming up on February 28th and 29th over in Houston.
Yeah, I would love to. I would love to be there.
Jenny, do you know any dentists who want to be really rich and successful?
I don't know one.
Okay. Then tell them not to
don't know about it. Yeah.
I'm just kidding. I think every single one.
Do you know any dentists that want to hire non-dentists to charge them $35,000 and not make them any money?
Yeah, definitely.
I know a lot of those.
You know a lot of those? A few that are looking for some consultants.
Yeah,
exactly.
So we are coming to your neck of the woods.
Yeah.
We actually just had a call today. It's getting exciting because we've got, anyway, it's just cool. That's that's really the only thing that Craig and I do from an outside the podcast standpoint. But it's really cool because you get to then, you, just like you were talking about, like the relationship with DIA and kind of, if they did it right, we get to kind of track the people who are now in our ecosystem, and it's really cool.
Of course.
Yeah, that's cool.
No, I've heard good things about it from last year. Actually, one of my friends in Dallas reached out and he's like, are you going to be going? I was like, yeah, I want to. And now I think my fiance wants to go too. So hopefully we'll make it that way. It's in February, right?
Yeah, we actually have a hygiene track too, which is really cool. We're just developing that. So Pete and I were actually talking about this morning. We're doing a 10 times guarantee on the hygiene. So if your hygienist, if you buy a separate ticket for your hygienist and she doesn't produce 10 times more, in the next 6
Whoa,
months.
wait, 10 times more than the cost of going to the summit.
No, 10 times more. So if they do 20,000 a month, we have your hygienist doing $200,000
Right,
a month.
exactly.
Your
That
hygienist
sounds
will be
great.
outproducing most oral surgeons in your neighborhood.
There would be
You
a
heard it
waiting
from
list
me.
out the door.
You heard it here first, kids.
Yeah.
If your hygienist doesn't do 10 times more, we'll give you your money back.
Exactly.
that's
So if
too
a
good.
hygienist doing like $1,000 a day, she needs to do $20,000 a day. Or
Perfect.
10,000, right?
Easy.
No, but at 10 times more than what you the cost of bringing her, we give you your money back. But we're excited about it all. This is very cool for us. And I just, the Audible came out, Pete. You heard the Audible, right?
Yes, and actually you can get it for the price of a cup of coffee. Did you set the pricing, by the way?
No, I think you can't.
Literally.
Amazon does
Well,
that.
how did Amazon
the
doesn't
gods
set
at
the pricing?
Amazon.
No,
There's 3 gods are ruled by Amazon, Facebook, and Google.
So Jenny, Craig
Yes.
read the audiobook, which I was kind of like, I don't know, maybe we should get a professional. But then I heard the sample and he clobbered it. Like I was so happy when I heard it because I was like,
Awesome.
I would have done horrible and he crushed
No,
it.
it's a torturous process.
No,
Jenny, if you
I'm
write a
sure.
book or when you write a book, most likely, do not do the Audible yourself.
No.
I'm like, I'm going to bang
but
this
everyone
out.
likes to hear the author talk.
Yeah, exactly.
No, I
And
thought I'm going to
that's
go in
that's
there.
Craig's metaphorical splinter. He doesn't have very big pain tolerance.
Oh,
Yeah,
it was
right,
so
right.
bad. It was so bad. It was
But
like
my
your
point is-
energy's bad. Reread that. I'm like, I reread it so many times, and I have to. It was not
Jenny,
fun.
so I get on and I look and I'm like, awesome, like cool, maybe we'll recoup some of the cost of writing this book. Maybe the
Right.
Audible's awesome. I look at and Craig sets the price at $4.87. I was
Okay,
like, that's
that's-
Starbucks.
No, I didn't say it.
It's way better for me to say you said it and me blame you than
Okay, fine.
than
Yeah.
Amazon.
Yeah, so you're welcome, everybody. $4.75.
So
Cost
I'm
me like a
all right,
grand of studio
Starbucks,
time and like cost
Starbucks
me my life.
triple venti or
Oh.
change your life. Which one? Pick it. Pick now.
It's a hard choice. No, just kidding.
Just kidding. I'm kidding.
No,
Well,
I'm
if
sure it's
every
awesome.
dentist on the planet bought a copy of our book, we make 33 cents per copy. So we would actually break even if every
There you
dentist
go.
on the planet, like
Perfect.
the Zimbabwean dentist that doesn't speak English, or actually we have a
No,
Zimbabwean
he
dentist.
does speak English, and
He
he's
does. Speaking of
He,
which, I
he's
gotta
listening right
I have
now. And
one
he took great
housekeeping
offense
item.
to that, Craig.
I'm so sorry, buddy. No, I didn't mean
He
Zimbabwe.
was awesome.
I
We
meant,
can talk to him.
yeah, it's true. We should get him on the podcast. What's dentistry like?
Zimbabwe actually is very proper English, as a matter of fact.
It's true. It's British. It's originally British. I do have one
Means
shout
language,
out.
I think.
I have one shout out. Ready? So this guy, his name is Doctor. He said, "Hey, can you mention me?" His name is, his first name is Erhan, and his last name is Tatlittle. Erhan Tatlittle. He practices in Victoria, British Columbia. He's like, "Dude, will you mention me?" I'm like, "Yeah, for sure. Great, Erhan, you're on, man. Thanks for listening to our podcast. Thanks for all the good stuff that you said about us."
Wait, what?
Yeah.
Is that really? Did you just really give a shout out from?
I
I
your
did. I
Instagram?
did. I just did it. We can edit it out if you really. If
Sorry
you guys,
for wasting everyone's time with that. Back to
I
our
don't know.
regular-
It just felt.
I'm just kidding, Craig.
Did I? Yeah. I mean, hey, listen. It feels good for some people.
Jenny, I'm glad to connect.
Yes.
You're
Thank
an
you.
amazing human. I can just tell,
Thank
and
you.
I wish you all the luck in the world. I hope to see you in February, and can't wait for the Yogi Dentist book to come out because I need some more mindfulness in my day.
Yeah.
You know, I think we all do. I think we all do.
Craig, did you just say yeah? You do?
Yeah, you do. Yeah, I mean, there's mindfulness around your friends. No, I'm just kidding. I love you, Peter. Jenny, it was awesome. So happy to have you on here. Thanks for spending the time with us and giving your wisdom to the people that are listening. It means a lot. We have to stick together. Dentistry's scary. It's a lonely place sometimes, and sharing stories that are vulnerable and intimate. The ones you shared are help us.
It needs to be more of a communal table, right, Craig?
Of
Just of
course.
sharing. And actually, I just need you to pay my bills too.
I do, Peter.
No, that's true. You do. You do the heavy lifting.
But I do want to thank you guys for having me on and inviting me on and just letting me have the space to kind of talk on whatever kind of came up to mind. I hope that some young dentists can hear this and have some tips and tricks to move forward.
And to our other podcasters out there who are possibly listening and sniping, I'm just kidding, just listening. Jenny bought a headset just for today. And I hate to think that this was the only time that she gets to utilize this headset.
She's on podcasts all the time.
No, she's not. She told me she wasn't, Craig.
I have not all the time, but I have been on another few podcasts, but I did notice that your email said an external mic was ideal. So I Amazon Primed this to the house at midnight last night.
Wow.
Yeah,
amazing.
thank goodness for
Looks
Amazon
legit.
Prime.
Commitment,
You've got a
right?
little bit of a
Speaks
Princess
volumes.
Leia thing going on right
You
now.
know, I do.
Because it almost looks like the Princess Leia hair thing, and the
Right.
Lululemon side zip does
Oh,
look
yeah.
a little. I
Oh,
like
you're
that.
not lying. You're not lying.
No,
That's
It's
actually
amazing.
funny. One of my patients said I look like I was from Star Wars with this jacket
This
too.
is amazing. We need to
Yeah.
screenshot this
It
and just
could
make
it
this.
could be Star Trek 2 though, right?
Right. It could be
Do me
Star
a
Trek.
favor. When we close, would you say
Great.
like Captain's Log 7, 5, 3, 7?
Whatever you want.
Can we end this with that
Oh my God, we're
Star Wars
so
theme though?
Yeah, please. Tell her what to say.
End it with Star
All right,
Wars
what do you
theme.
want me to say?
Just I don't know. I'm not a Trekkie. I don't know this stuff. I just
I'm
wanted
not
to end
really
it
a
with
Trekkie
something, and
either.
I don't. I think you got more of
Well,
a Star Wars.
you obviously just confused Star Trek and Star Wars, by the way.
She looks futuristic, is what I'm trying to say.
I'll take
She's
it. The
futuristic
future
yoga.
of dentistry right
Yeah,
here.
right
There you
there,
go.
right there.
That's it. All right, Jenny. All right, everybody,
guys.
over and out. Thanks for tuning in,
All
and we'll
right.
catch you next time.
Awesome,
Thank
guys.
you.
Thank you. Thank you.